Hepatitis C has been called a silent epidemic. That's because most people don't even know they have it. We've come a long way in terms of understanding and treating the virus, but there's still a lot of confusion surrounding it. Joining us now to clear everything up, please welcome Dr. Stanley Lewis and Rodney Goodney with the St. Hope Foundation. Good morning, gentlemen. All right. Hep C is one of those things that we kept hearing about, Hep C, but I think people still get it confused with other hepatitis forms and don't quite know what it is.
Right. So there are essentially three. There's several, but the most common, hepatitis A, hepatitis B, and then hepatitis C. Hepatitis A is primarily an acute infection, and you usually clear that.
Okay.
Hepatitis B and hepatitis C can become chronic infections, and they are transmitted in some similar ways. But hepatitis C is the really big epidemic. There are probably about 200 million people worldwide infected with hepatitis C, and about 4 million of those people live here in the United States.
We know there's different ways that people can get it. We know if you're an IV drug user, you share needles, that can happen that way, but sometimes ways that people aren't even thinking about. I was talking to you about a man who, his father had Hep C, had not been diagnosed yet, and he was staying with him in the hospital, and he used his razor.
Right.
And then all of a sudden found out that he had Hep C as well. Toothbrushes, things like that.
Right. So blood-to-blood contact is the primary way of getting hepatitis C, and sure, injection drug use is a simple and sort of easy way that you can clearly see you would be at risk. But some of the other household risks, like razors, like toothbrushes, and tattoos are also another way that...
and of course there's new mandates in terms of safety, in terms of tattoos, changing the needles, changing the ink, all that type of stuff. Absolutely,
and these are very important ways in curbing that epidemic.
Okay, as you said earlier with HIV/AIDS, the biggest thing is to know your status. A lot of times people don't go to a clinic or a hospital because they can't afford it, and St. Hope Foundation is just such a different way of approaching healthcare and so needed today. Explain how it works.
Well, we are a newly funded, federally qualified health center. There were only 2 in the state of Texas, and we were one of those last year that were recently funded. Our services really are comprehensive. The easiest way to describe it is that we're a one-stop shop. So basically, if you come in, you can get primary care, you can get dental care, you can get psychiatry.
Dental care, that's a huge deal because that's an area that oftentimes, even with insurance, is tough to pay for.
Vision, psychiatry, podiatry, prevention services, and one of our new initiatives, which is the Hep C treatment clinic.
Yeah. What do you have to do to qualify to get health care?
We can serve insured or uninsured. So if you have insurance, we serve you. If you're uninsured, we can also serve you through a sliding fee scale. It can be as low as less than $20 for a visit.
Wow.
The wonderful benefit is that we also have pharmacy services on site, and so it really saves people traveling from one location to the other to pick up their medication from CVS or Walgreens. Our pharmacy is a 340B pharmacy, which allows us to offer it at a significant discount to the patient, cheaper than what they would pay at Walgreens or CVS or Walmart.
Yeah, and that's a great incentive to get somebody to come in, because when people can't afford it, they will put it off or just not go. And in the case of something like Hep C, the longer you ignore it, could it be much more debilitating?
Oh, absolutely. So Hep C is a chronic infection for most people. About 80 to 85% of persons who are infected with hepatitis C will have it chronically.
Okay.
And it can lead to liver disease, liver cancer, and even death.
Oh.
So it's very important that you get tested, and if you are indeed diagnosed with hepatitis C, that you see a healthcare provider to look into your treatment options.
What are the symptoms? Who should get tested?
The symptoms of an acute hepatitis C infection are very similar to other viral infections, fever, headache, that sort of thing. But
Ebola mimics everything.
Viral infections are kind of like that, in that they're common in that regard. But the thing with hepatitis C is because it loves the liver. You can also get jaundice. So jaundice is the one symptom that
yellowing of the eyes.
The yellowing of the eyes and of the skin is also a very good indicator of a person may be infected with Hep C.
Do we have a treatment or a cure for it today?
Yes, we do, and we're very excited about the progress that we've made in terms of hepatitis C treatments. Before, treatments involved injections, and those injections were quite painful and had a lot of side effects, and some of the other medications that we used in combination with those injections were also relatively onerous to take. But recently, there have been some new medications approved by the Food and Drug Administration that are simple, much shorter courses of therapy, and much more tolerable than the older ones. And they have about 90% cure rate.
Wow. Okay. Well, you don't know unless you get tested. And
Absolutely.
if you get tested, you can get well. Well, for more information on the St. Hope Foundation or to schedule an appointment, you can visit offeringhope.org, offeringhope.org, or call 713-778-1300, 713-778-1300. Thank you, gentlemen. Finding quality health care for those in their golden years can be a real trying experience, but we'll show you why there's no place like home for personal care next.